Hello and welcome to the latest MS Hear from the Experts webinar. This series is helping people better understand multiple sclerosis, highlights MS-related resources, plus provides tools and tips to navigate their MS journey with more knowledge and confidence. Our intention is to help you learn more about the disease, treatments, research, wellness strategies, our programs, and much more. My name is Gabrielle Vito, and it's my privilege to be your moderator for today's broadcast. I am a longtime volunteer with the MS Society of Canada since my own diagnosis way back in 1996. I've had the privilege of working in various areas throughout the organization. Most recently, I sit on the executive for the MS Ambassador Program, and I am a facilitator for a peer support group. So welcome today to both our audiences on Zoom and those joining us on Facebook Live. Now, MS Canada would like to start this session by acknowledging that we're on the unceded and ancestral territory for First Nations, Inuit, and Métis people across Canada. These nations have cared for this land from the oceans to the mountain peaks for thousands of years and continue to do so today. We thank them for their continuous care and for the opportunity to host this session today. At MS Canada, we're committed to learning from and working with Indigenous peoples to care for the land that we all call home. Now, before we get started with our presentation, let's briefly go over a couple of housekeeping items. Your microphones have been muted and will remain muted for the entirety of the broadcast. If you have a question, please type it into the chat box at any time. We'll try to get to as many questions as possible following the formal presentation. Please note that questions pertaining to specific personal situations likely cannot be answered in this type of a venue, and we recommend contacting your personal MS healthcare team or perhaps contacting the MS Knowledge Network for your personal questions. This session is being recorded and will be available soon on our website and YouTube channel. A Facebook Live recording will also be available as early as tomorrow. Please note that MS Canada does not approve, endorse, or recommend any specific product or therapy, but provides information to assist individuals in making their own decisions pertaining to their health and wellness. Also, the views and opinions expressed in this presentation are those of the speakers and do not necessarily reflect the views or positions of MS Canada. Now, we want to just give you a word on who we are. Formerly called the Multiple Sclerosis Society of Canada, like you heard me refer to it, we've changed our name to simply MS Canada. We've got a new name and a new look, but we're still committed to keeping people affected by MS at the heart of everything we do. Since 1948, we at MS Canada have been proud to be a part of a community of people living with MS, their families, friends, plus volunteers, donors, researchers, clinicians, and many, many more. Together, we have helped fund research, provide information and support to people affected by MS, and we've taken a bold stance to advocate for changes that allow people living with MS to live full and inclusive lives. Our current strategic plan not only lays out the roadmap in our journey to create a world free of MS, but we hope it also provides inspiration for all in the MS community to connect and collaborate. So together we can advance treatment and care, enhance well-being, understand and halt disease progression, and ultimately prevent MS from happening. Now, today's broadcast is an opportunity to learn more about practical tools for support and accommodation planning with regards to employment. MS Canada has partnered and been working with Accommodating and Communication About Episodic Disabilities, which was a research initiative. It has led to the development of the Job Demands and Accommodation Planning tool. Today, we'll learn more about this tool that can support employees and their employers when living with episodic diseases. Our first presenter today is Dr. Monique Gignac. She is the Senior Scientist at the Institute for Work and Health and a professor at the University of Toronto School of Public Health. Monique's research expertise is in the areas of health and social psychology, including psychosocial factors like stress, coping, plus adaptation, and their importance in understanding the impact of long-term conditions on the lives of adults across the life course. Our second presenter today is Amanda Fraser. Amanda is an MS Canada ambassador. And today she'll be telling us about her experience working on the Executive Advisory Committee for the development of the Job Demands and Accommodating Planning tool, and her perspective working as a registered nurse with MS. So welcome to Monique and Amanda. Thank you so much for being here, and I now turn the broadcast over to you both.
Thank you so much, Gabby. So I will start today. Hi, everybody. My name is Amanda Fraser, and I'm here today to share my experience working as a registered nurse and living with MS. I was 3 years into my career when I was diagnosed with multiple sclerosis, and I was working in the pediatric intensive care unit at the Stollery Children's Hospital in Edmonton, Alberta. As a young and vibrant RN, I was moving up quickly in leadership roles, the equipment I ran, and the fragility of children I cared for. I yearned for more knowledge, and I took extra courses often. I was required to critically think very quickly, react even faster with dexterity and care, and anticipate and prevent negative outcomes before they even became issues, and do all of this in the middle of the night to keep someone's child alive. So to say I was terrified about what my MS diagnosis could do to my aspiring career is a serious understatement. But I kept assuring myself that I would continue to be the nurse I always was. I didn't have the usual coming out or discussion regarding my diagnosis with coworkers or management. I was hospitalized actually down the hall from where I worked. So my coworkers and managers knew that I had MS within days of me finding out. At first, I'm going to be honest, this made it pretty easy, but looking back, it also allowed for decisions to be made too quickly. It gave me no opportunity to stop and think about what my goals were with my career or how I could still achieve them with this diagnosis. Many assumptions were created and permanent decisions were made before I even had time to understand what MS meant for my life. When I returned to work, I was immediately decreased to part-time days instead of working days, nights, thinking that if we managed the physical hours and the time I was there, it would be enough of an accommodation. I also was often assigned more leadership roles on the unit instead of physical patient care because of my unreliable touch. Thinking again of only one aspect of my job needed tweaking for it to work for me. I was able to manage this for years, other than the fact that I used every sick time, vacation hour, and go home early card I could as my fatigue was worsening. When my MS rapidly started to decline years later with extreme fatigue, brain fog, numbness and tingling in all my extremities, and loss of motor function in my legs, forcing me to resort to a four-wheeled walker for my mobility, my manager and neurologist were quick to take me off work completely for a month or two for rest and rehab. This would happen a few times, and once I would recover, I would do the very single-minded standard return to work with reduced hours and modified duties, often office work or caring for the least critically ill children. All of this was an attempt to keep the stress, mental, and physical demand low on me. I was trying to address more aspects of the job that were causing me to fail, but none of the interventions were right for me, and I often didn't even know what wasn't working. I did ride this merry-go-round for many years, feeling like I was failing though. Every time I had to be sent home early, ask a coworker to complete a task for me, or call in sick for that last shift that I just couldn't get myself up for. It was honestly destroying my self-confidence and my sense of self. My aspirations for striving to learn more were totally gone. I could barely do the bare minimum of my job. I was very overwhelmed. Too overwhelmed, to be honest. And there were so many factors to consider between physical health, mental health, finances, benefits, let alone my original career aspirations I had. I was very confused and unaware of what I actually was capable of consistently accomplishing. My health was getting worse, but not constantly or consistently or even really noticeable to the world. But honestly, I was barely surviving. My symptoms are super variable and unpredictable, as many of ours are, and I had no idea how to make work for me. I knew I still wanted to work though, which is why I kept going back and trying. But honestly, I just kept failing. I was calling in sick and I was very unreliable when I was there. It wasn't working for me. It wasn't working for my coworkers, and it definitely wasn't working for management. I hated letting everyone down, especially my patients, and it just seemed easier to go off of work. So in 2019, when my doctor took me off for a complete year, I took it quickly, thinking I would have enough time to figure it all out. I was going to stabilize my MS and return. But as we all know, COVID happened very quickly after that, and my time off of work became permanent long-term disability, and I honestly have never gone back. So there is more to my story over the last 3 years that I do want to share with you. But first, we're going to hear from Monique as she discusses more about employment and living with a chronic illness. She's going to be introducing us to an amazing new online tool that's going to help those of us living with MS navigate the turbulent and murders of work life. I'll pass it over now.
For the opportunity to be here. I really want to thank Amanda for sharing her story and her experiences. And as she mentioned, I'd like to talk about a new tool that we're hoping might help people with MS and other conditions. So I'll go through some slides with you to talk about the tool, and then we'll come back and Amanda will share more of her experiences. Oh, I think Gab, sorry, I'm seeing here that you had something else up. Did you want to speak to this? No? Okay, sorry. All right. Amanda and I are going to talk a little bit about this job demands and accommodation planning tool. Whenever a tool like this is created, I think it's really important to acknowledge that there are many, many people behind its development. And that's very true with this particular tool. We are, as Gab mentioned at the beginning, a group called ACED, Accommodating and Communicating About Episodic Disabilities. You'll see lots of names here. These individuals represent a whole wide range of different expertise. So we have occupational physicians, physical therapists, occupational therapists, clinical psychologists, health and social psychologists, ergonomists, web designers, a whole lot of different folks. Also important is we've had a number of partners all along the way. And I want to highlight that MS Canada has been an incredible champion of the research. And a lot of folks have taken a look at the tool and even participated in the study. And the studies we've done, you'll hear more about that later in the presentation. And of course, I want to acknowledge Amanda, who has been part of the development of the job demands and accommodation planning tool, as well as a new communication decision-making tool that we're working on. So when people are living with a condition like MS, a number of issues arise, and Amanda highlighted these, this sort of changing nature of the condition, how it's often unpredictable. Others may not know what you're living through. So these create challenges in the workplace. One of the first challenges that arises is whether or not to disclose or say something, or how much to share with individuals. And then, of course, there are also challenges and decisions to make around how to provide support or accommodations to really help people remain at work and maintain productivity. So if I were to depict something that's very, very complex in a simple way, people often tell us that they have a problem or a support need. And the two questions we hear most often are, should I say something, and what can I do? So this ACED partnership group has been working on two different tools. One of them we call Decide, and it's a communication decision support tool. It's being programmed right now. It's not available yet, but it will be later in the spring. The other tool, this Job Demands and Accommodation Planning tool, or JDAPT, is available. It's freely available. No personal information is asked about it. There is a link to the entire website for the group, but I'll give you a link to the tool in just a little bit. We had a number of goals when we were creating this particular tool. So one of them was to adopt more of a prevention and a support framework. In other words, we wanted to try to help people with MS and other conditions be more proactive. So there would be less of a waiting for a crisis and then responding. We knew with the tool that we would have to integrate it with existing workplace support processes and people. And so we wanted something that would kind of seamlessly fit in with what workplaces already have. Wanted to, of course, provide ideas for practical support to meet work demands. Wanted to be relevant to a lot of different types of jobs, different disability types, sectors, small organizations, big organizations. We know we can't have a tool that will suit everybody's needs. And so we hoped that we would be able to promote discussion and brainstorming with the tool, and with that, then improve the outcomes for people, help people to stay working longer. And of course, we wanted something that would be interactive and accessible, not just a list of think of this or think of that, something, of course, based on evidence, and that would protect people's privacy, because we know that people are often very reluctant to share information and would like to find out ways of managing without necessarily everybody knowing what's going on in their personal life. So what the JDAP does is it focuses on work demands that may be challenging at times or regularly. It doesn't focus on the health or a disability diagnosis. So it doesn't focus on telling people what it is that you're dealing with in terms of symptoms, but what you're dealing with in terms of your job. And it would guides a user through a series of very simple questions about job tasks and working conditions. And then anywhere a person says they are having some struggles, some difficulties, it provides a personalized list of supports to help generate solutions, things that might work for people. And we've tried to give a lot of different ideas. The tool can be used on one's own. You don't have to share it with others, and there are strategies that a person can use on their own, or it can be shared with other individuals. Now, back in 2022, we entered the JDAPT prototype into an inclusive design challenge that was being sponsored by Mars, which is a venture capital group, and CIBC. And it was focused on providing support at work. And the JDAPT was actually the grand prize winner, which was terrific. But we've been trying to continue to improve it, and obviously would love your input if you do take the tool. So the way it works is that there are 24 different job demands that a person is asked about, and they're organized into 4 domains. So there are some questions about a person's physical demands at work, questions about those kind of cognitive or thinking demands you might have with your job, working with others, and working conditions. And I should also mention that there are 3 different versions of the tool. So there's a version that you can fill out as a worker and self-assess your needs, but there are also 2 versions for organizations. In one version, a supervisor or an occupational therapist or someone who's familiar with a job that, for example, you might be working on, that they can fill out either on their own or with you. And then there was a 3rd version we created because we were asked by workplaces to help them think of ways to make work basically more supportive, even when they weren't thinking of a particular worker in mind. So they get asked the job demands and they can fill it out, thinking about supports that might be available for that job. So for each demand, I'll talk about the worker version, the version that you might fill out. You would first be asked, is this particular job demand important to your work? And if you say, no, this is not something that I have to do really as part of my job, you would move to the next question. If you say, yes, this is something that I do in my work, you're then asked, are you having any difficulties? No difficulties, some or a lot of difficulties. And you're asked, do these difficulties change over time? So maybe things are fine now, but sometimes it's worse. So to get a little bit more at the variability. From there, you get a personalized report, and it links to different strategies that you can use for those demands that you say are difficult for you. And you can save all of these in a PDF, and we don't ask again for any personal information. Oops. So let me just go through, oops, sorry about that. I hit a little too fast here. Let me just go through a little bit of what the tool looks like. I know you can't see this very well. I'm not going to go through any details, but there is a link up at the top there. And if you clicked on that link, what you would see is this sort of a landing page. And from here, you can choose the tool that you want to use. So there's the top two here are the worker versions. And I should mention that we have all the versions in English and in French. So you can pick to do the tool in either language. And when you have selected which version you want, you just click on it. And you would go then to basically an introduction page that just talks about, well, what is this tool? How does it help? What it isn't, so it doesn't provide legal advice, it doesn't provide medical advice, and a little bit about the team behind the tool. From there, you would click and go into the instructions, which are what I talked about a moment ago, that you would be asked some questions about whether a job demand is important to your job, whether you're having any difficulties, and then whether or not this changes over time. And then you move into the questions. Again, I know you can't see all of this, but these are two screenshots. And on the left-hand side are just some examples of the physical demand questions that you would be asked. If you wanted to know more about what this means, if you look on the right, you can see examples perhaps, and it opens up to give you some concrete examples about what we mean. And then you can see that if you said that this was important to your job, you're asked again whether it's difficult or not, and whether it changes. The same with we have cognitive demands. So you get the very same kind of pattern, which makes it very easy to fill out. And you can also save a draft if you want. So you can come back to the tool if you're finding it's taking you too long or something interrupts you, and you can add some job demands if there are specific things you want to keep in mind as well. So when you're done, all the questions, these again are two different screenshots. You get this summary, and the important pieces, I guess, that I want you to notice here is on the bottom left, you'll see a 16 of 24. So this fictitious person has filled out the JDAP, and they've said that of the 24 job demands, 16 of them are important to their job. So it's now starting to help you focus on areas that are relevant to your work. And then over on the right, you see some different colored bubbles. One of them on the left says 8 of 16. So this person has said, of the 16 job demands that are relevant to my work, I'm having difficulty with 8 of them. And below that, 7 of those 16 are changing. They're not always the same. So it starts to kind of piece together a story. The other colored bubbles are just breaking it down into the different sections. So the physical demands, cognitive, the working with others, and the working conditions. So it gives you this kind of overview summary so that you can start to kind of put the pieces together. Once you've seen the summary, you now would move into getting different strategies. And this isn't the way it looks in the tool, but we've kind of organized it this way so it can we can kind of show you what we've been doing here. If you said that physical endurance or stamina, and that's on the far left there, is a job demand that is important to your work, and you're having difficulty with it, that was something that Amanda mentioned was important to her job, you get some ideas of things you can try on your own, things that you could perhaps try on your own or more informal supports, and then more formal accommodations that you might have to request and speak to others about. For every single one of the job demand, or the strategies rather, we provide some concrete examples. So we break it out to get people thinking, because again, we know not everything's going to work for everyone, or not everything may be available to someone in their job. But we hope that by giving different examples, it will help people really get thinking and brainstorming about things that they might be able to do. So this slide, all it does is it's changed now. It's concentrating for long periods of time. And so now you get different strategies. Again, things you can do on your own, things that you might be able to try at work on your own, and more formal accommodations. And again, lots of examples for all of them. Because there's a lot here, the other thing that you can do is you can click on beside any of the strategies and create a personalized list. So if something won't work for you, but there are maybe 4 things on this list that you think might be helpful and might be available to you, you can click on those so that at the end it will create a shorter list, something that is more relevant to you. So when you're done all the questions, you would now have a choice. You can save, there are, again, I know you can't see all of these, but there are 4 different files that you can save. One is just the general summary. Another one gives you all the different job demands you said were a challenge for you. You can get all the strategies printed out if you want, or you can have a personalized list or any combination of these different files you can save for yourself. So that's just a bit of an overview of the tool. Let me tell you just a little bit more about what went into coming up with some of these strategies. So from our perspective, what we wanted to do was really emphasize strategies that would prevent harm, promote individual capacity, and manage not just health, but personal, social, and the environmental challenges of work. We wanted to be very concrete and specific. So we don't say things like, oh, you should avoid stress at work. We know that everybody would love to, but that's just not the reality of it. Wanted to try to find a real range of examples so we could, again, suit different types of jobs and needs. Wanted to provide, again, as I've mentioned, strategies you can do on your own, because we know so many people don't want to share information with others, as well as supports that you might have to involve others. We do provide some lifestyle strategies in the list, but mostly we focus on the workplace. And we wanted to do that because that's where there's a real gap. People, including people whose job it is to support people living with MS and other conditions, often say they just don't know what to suggest to help people. So this really helps identify components of work and things that you can do. There are certain things we didn't want to do as well. So obviously we don't provide clinical or rehabilitation or legal advice. We don't name specific products or brands because that can also be very individualized. We try not to be too prescriptive. So you're not going to see something like, oh, you should work 4 hours a week for 8 weeks and increase to 6 hours. That's really where you need some additional professional expertise to work through some of those issues. We avoided strategies wherever possible that we thought would be too cost prohibitive for most organizations. And we avoid suggestions that don't link to a certain job. So that does mean there are good ideas out there. So a support group, for example, might be helpful in your organization, but it doesn't necessarily link to a job demand. And so we haven't focused as much on that. At some point, we may be able to build in more of these, but right now we stick with the job demands. So that's a bit about the tool. Let me just finish up this evening with a bit more about what others have said. So we've done a couple of different studies. The first one is a study that we did early on to make sure that the tool questions were comprehensive, people understood them, they thought they were relevant, something that they could actually fill out on their own. And so to do this, it was very labor intensive. We sat down with people and we went through every single question. Do you understand what this means? Are these examples helpful? Should we add more? Is there something missing? And so our goal was to have at least 70% of people in the study say, yes, this tool makes sense to me. It is very relevant to what I'm doing. It's the length is okay. I can manage it all. We had 46 workers who were living with different physical and mental health conditions, and a number of people lived with both. There were a number of people with MS in the study. And we had 23 organizational representatives, so people like supervisors, HR, disability managers. Overall, we found that at least 3/4 of the sample said that that this was comprehensive and relevant to them. In fact, sometimes over 90% of people said it was. We added 3 new items because that's where we did have a little bit of, I guess we were just around 70%. So we wanted to put more diverse items in there. So that was the one change we made to the tool. So here are some quotes, and they're all from people with MS. The JDAPT was helpful. It broke it down into good categories, gave good explanations, and then it was very uniform. So when I completed one section and I moved to the next, it was basically asking me the same thing, so I didn't have to reread everything again. They were very clear. The examples were really helpful. I found it easy to fill out. It's not demanding or intimidating, because that's something to be mindful about, that a lot of us get mental fatigue, and I feel the questionnaire was respectful of that aspect, so no concerns from that perspective. So that was our first test. We are just finishing up a second study now, and this one is one where we followed people for 9 months. And we looked at use of the JDAPT and was it helpful? So when we first met people at time 1, we asked them a lot about their health and their job and their perceptions of work, how it was going for them. They had not seen the JDAPT at all. So after we got that information, we sent them a link to the JDAPT, and they filled it out, and they told us what they thought about the tool just right after filling it out. 3 months later, we went back to them and we said, have you used it at all, the JDAPT? Has it been helpful? And we got more information about what was going on at work now. And then another 6 months later, or 9 months from time 1, we went back to people again. Same thing. Have you been using the JDAPT? If not, why not? What do you think about it? And how is work going? And asked a lot of questions about it. So we started with 269 people. We had 76 people with MS at time 1. And then at time 3, we had 188 people left in the study. That's 70%. And although it's a drop, I have to tell you that very often with interventions like this, you'll have fewer than 50% of people who are able to stay in the study. And often that's because of health changes or job changes. People do drop out. But we still had 58 people with MS who were in the study, which we found very helpful. That's about 30% of the sample. So here again are some quotes from people. I mostly used it to think about how I might change things within my control. I did not use it formally, as I didn't feel it would be supported by management. So that's not uncommon. Again, people want those strategies, as I mentioned, they can do on their own. Someone else said, I stopped and thought about how advocating for myself earlier on is important instead of just powering through. I had open conversations with my supervisor about possible future needs. I reviewed the JDAPT before the conversation. So that was good to hear. Again, some people are using it proactively, not waiting for a problem, but now the tool was able to help them think about where there could be problems. Another person commented, the JDAPT helped me to manage my work demands so that they posed as little risk as possible to my health. I appreciated the concrete strategies suggested, and I was able to try different strategies on different weeks at work to see how best to incorporate them. A lot of it still doesn't come to me as naturally or as easily as I would like. I'm still too reactive in my environment, so I need to have the reminder of options and strategies which the materials offer. We even had people say they post things, or at the beginning of every week, they kind of review to try to kind of, again, get in the framework, be more proactive, trying to take better care of their health. And so just to kind of finish, I mentioned we collected a lot of information about people's jobs, how it was going. And we looked at whether or not this changed. Did things get better over time? So some of what we asked people were questions about how confident they were that they could solve problems. And again, we asked this before they ever saw the JDAPT. And so this kind of confidence is sometimes called self-efficacy. How confident that were people problem solving? How confident were they in meeting job demands? And how confident were they in meeting their emotional needs? So dealing with stress, dealing with worries and fears about the future. And there are a number of questions to assess each of these. We asked also about difficulty getting as much work done as others expect you to, whether people were having work productivity problems, and we asked how absent people were in the previous 6 months. What we saw from time 1 to time 2, so after people finished the JDAPT, and also even 9 months later, were positive changes in all of the directions that we hoped. So, and these were highly significant, and so unlikely to be related to be chance. So people were better able, or they were more confident that they were able to problem solve, more confident that they were meeting their job demands and their emotional needs. They were reporting fewer difficulties getting as much work done, fewer work productivity problems, and less absenteeism. So these do seem to be real findings and not chance findings. But there's another thing you can look at to sort of see how meaningful the changes are, and those are called effect sizes. So is this a big change or a small change? If you have a number that's around 0.2, it may mean that the change is real, but it's fairly small. If you have a number around 0.5, this is a moderate, probably a more meaningful change, something you probably notice. 0.8, it's very hard to see anything that size in a rehabilitation intervention. It's the kind of thing you see more with surgery or dramatic medications that can change a person's life. But what we were very pleased to see here was, although absenteeism was a real change, it was a small change. The other changes were all moderate and even approaching large. So although everybody's situation is different and not everything will work for people, sometimes people do have to change jobs, as Amanda had to do, had to take leaves of absence. We are hopeful that the tool really can provide something that, especially if used early on, might help sustain work longer. So I'll just, again, finish noting that the tool is freely available. We don't collect personal information that would identify anybody. We don't ask for anything. You can download and save your responses, but we don't save any data from the tool. We don't know who's filled it out. We can get a little bit of Google Analytics. So I can tell you right now that the worker version has been out for not quite a year yet. The other versions came out in the summer, so they're even newer. But so far, we've had about 8,000 unique visitors. We've had a number of people coming back. So about 8,000 unique visitors to the tool. That's not just the landing page, but who went into the tool itself. We've had about 3,900 people or 3,900 downloads of the PDF. Most of the visitors are coming from Canada, but we've had about 2,000 from the US, UK, and Australia, and a lot of other countries as well. And I will stop there and turn it back over to Amanda to talk a little bit more about her experiences with the JDAPT.
So much, Monique, for walking us through this incredible tool that I am personally super, super excited about. Can everyone hear me okay? For me, I honestly believe that if I had access to a tool like the JDAPT, it could have helped me change the trajectory of my career and maybe have even prevented its early ending. When I was in the thick of it, I was so overwhelmed. I couldn't even begin to break down these areas of issues, the components of how I was struggling, or the attempt to even make a plan or adapt or accommodate my work demands and environment. I honestly didn't even really know what my options were, let alone how to advocate for myself. And honestly, this is why I am very passionate about this tool and its ability to help you plan before a crisis. I was in crisis and I couldn't plan, and I ended up just making quick decisions to be off of work and not thinking through all of it. So to be able to break down each area of your work life and actually get concrete ideas, not just be less stressful. And you're like, right, that's a good one. And summaries of how to make your specific situation work for you is what so many of us are looking for. If I had had the JDAPT ideas of how to adapt, advocate for myself, it could have made all the difference in me succeeding while I was at work instead of feeling like I was failing. And could have been competent and consistent in my role that truly meant everything to me. But honestly, what I also really, really like about the JADAPT is the ability to take it more than once. You guys, you can use it as a baseline tracker. As we all know, our symptoms can change with the moon, but never in a nice linear pattern for us. So having a tool that can help you assess and then reassess your abilities at work will just help prepare you for managing your health and your work-life balance way more proactively, so we don't end up in these crisis situations that a lot of us find ourselves in, unfortunately. So over the past 3 years since I've been off of work, I have been on a journey of health and wellness and continued self-fulfillment. Going back into a nursing career is not going to be it for me, but being an MS ambassador and being introduced to the Accommodating and Communicating about Episodic Disabilities Research Organization and having the privilege to sit on the expert advisory committee to help create the JADAPT and now the Decide tool has been a huge part of that self-fulfillment that I've been able to get back. Immersing myself into volunteer work, public speaking, and advocating for MS while providing my professional and personal experiences, along with my opinions on these different committees, has fulfilled me in ways that I honestly just didn't think were possible anymore. So I am so thankful for those opportunities and these tools that are around. Now I honestly use the JADAPT to help me monitor my volunteer work. You can kind of use it for what you need it to be for. Maybe it doesn't directly apply, but it allows me to break down my strengths, my weaknesses, what type of environment is going to be good for me, and how I can succeed in this newfound purpose I have of sharing my story and advocating for those like me. So I just think it's an amazing tool, and I'm excited to share it all with you, and I'm excited about the impact that it's made in people's lives already. And yeah, I'm glad that we've had this opportunity. So thanks for listening to my story about it, and we're happy to go on with questions and answers now.
Wonderful. Absolutely fantastic information and fantastic perspectives from both of you. Thank you for explaining it so clearly, what it is, how it works, and how it can help. And hearing your personal story, Amanda, is just the icing on the cake. So I really, really appreciate both of you being here. Now, we do have a few minutes left for questions. If you haven't already out there in Zoom land and Facebook land, please share your question into the chat box and we'll get to as many as possible. I'm going to start off with one that occurred to me as well. Someone is asking, they're curious about the organization aspect of the tool. Can it be, and has it been used by many organizations as opposed to individuals?
Yeah, so those versions were just introduced in the fall. We're doing a lot of work with different organizations. I can tell you that we have had one of Canada's large financial organizations. They are trying it now. We have one of the biggest departments in the federal public service. We're doing a workshop with them in April because they want to start using this for all their staff who are requesting accommodations or to help them think through things. We have talked to a number of different professional groups, so occupational physicians, occupational therapists, and some hospitals about using the tool. So yeah, it's starting to get out there. We'd love to have even more groups use it over time. But yep, we're moving that way. And I wanted to just say that the organizational version is different also in one other way from the worker version. The questions are all the same, but the people who are at the supervisory or HR level, they get more strategies that often a worker can't ask for. So they get things like think about skills training, think about development activities. And so Amanda, you mentioned doing maybe, more leadership, more case management kinds of things. So we ask them about that, or think about bigger environmental changes, how work is laid out on the floor kind of thing. That things that a worker wouldn't necessarily ask for themselves, but that an organization should be thinking about.
Wonderful. Now, another question we have kind of along the same lines. Can you give us any perspective on the success of adaptations and accommodations in certain fields? Is that something that your research has touched on at all?
Yeah, good question. So we have, yes, and I can answer that. We did have a number of different types of jobs from different sectors. So we've have a fairly good representation from healthcare, education. We've had truck drivers, we've had cooks, chefs. So we've had a lot of different people in the study. We've looked to see, were there any differences in our last study in what we heard from people. And for the most part, there are no differences, which is to say that men and women, younger and older workers, contract workers, permanent workers, and people in different sectors found it equally helpful. Having said that, I think if you were a police officer or a first responder, there will be strategies that, won't necessarily be covered here if you worked in mining. So we could work to create something that is more specific, but we've had very good initial success suggesting there's really a good range of strategies that cover a lot of different types of jobs.
Excellent to hear. All right, our next question here is about access to the slides from today's program. And I can tell you, I can answer that one. If you email education@mscanada.ca, they can be sent to you. So again, that's education@mscanada.ca, and we will have that up on the screen at the end of today's broadcast so you can jot it down at home there. Next one is not a question, but a compliment. Someone saying, wow, I had no idea this exists. I've been in a bubble running my own business, self-employed, for 21 years. This gives hope for my future career planning. I've thought about going to college and entering a new career field in finance and accounting. Go, we've made an impact already. Glad that it helped. Next question is, more employers need to be aware of this. How can we help spread the word about it?
I can even just
if you're
say, I was just going to say something really quick. One way that I've spread the word is my dad owns a small business. I sent it off to him and was like, hey, this is something that's cool out there. Have you created? I just sent the link. Same with my husband's work, my friend's works. I've just shared the link. So I think in terms of spreading the news, like the link will be shared, I'm assuming, and Monique can add more to this. But I think just word of mouth and just sharing it on your own and telling people that there's a cool new tool out on the streets that you can use.
Yeah, I was going to say the same thing, Amanda. We're trying to do more formal ways of getting information out there. We have government contacts, we've got some work networks. But honestly, I have done an awful lot of what Amanda is saying. I've shared it with friends who work in various, sectors and said, if you're willing, share it with your employer. Tell them it's worked for you, or just say, hey, I found this. You might want to check it out. And we've also been trying to go to like HR and disability managers. But the more you can just share the link, the better, because somebody's going to grab it and run with it.
Mm-hmm.
Wonderful. That's great advice. Sharing it within your own network, that's exactly the way to start. Okay, our next question touches on something that you did refer to, Monique, that this is one thing you tried to stay away from, is giving legal advice. This question is there any legal requirements to accommodate a person that has various levels of disability? Is that an area you can talk about at all?
I can very quickly, and Amanda, jump in also if you've got experience here. We have a couple of human rights pieces of legislation you should be aware of. One is the duty to accommodate. So an employer is required legally to try to provide supports for people living with a disability, to the point of undue hardship. And that's where it becomes a little messy. If, for example, an employer said, they weren't able to, this would cost them money. Obviously, if you have a job that's public facing and you can't be there, they can't accommodate some of these kinds of things. But there's a lot more room for support than often people think. And an employer has to make a concerted effort to try to support someone over time. They can't say just, no, that's not going to work for us. So yeah, there are links that you can look up, duty to accommodate. Look up undue hardship and you'll get that legislation and you can learn more. We also have privacy legislation that you don't have to disclose what your diagnosis is or your symptoms, although you may have to provide verification that you are living with something that would be like a confidential letter from a doctor. But that also is why we wanted to help people. It's like, well, then what do I talk about if I'm not going to tell people I have MS, or I'm not going to tell them I'm dealing with fatigue? What you can talk about is the job demand that you're dealing with, using the tool, as Amanda was saying.
Yeah, and I guess for me, what I would add on to that is to just advocate for yourself. Like, do the research, find out on your own what your specific organization needs to do. And it's just by asking the right questions to your HR or to your management, even without having to say, hey, this is my diagnosis, just, curious about policies and procedures around it. And unfortunately, a lot of it does come back onto us to be doing the research and figuring out what your own individual rights are. So that would be kind of my biggest advice, is to just take the time to truly look into some things, and so you can know how to advocate to yourself correctly.
Okay, I think that's great advice. I'm just going to look here. Our next question has to do with consultation of unions. Were unions consulted during the creation of the tools, and are they aware of them? Kind of a big question, but I think that's a good area.
So we would like unions to be more aware. But yes, we had unions participate early on. We did what we call key informant interviews with different people whose job it is to provide support in workplaces. And we asked them about what are the issues and the challenges you're facing. And that included union representatives, labor lawyers, supervisors, disability managers, HR. So we talked to a lot of those folks. And then we also had some of those individuals when we were testing the tool. Unions are a little bit of an interesting group. Traditionally, there has been we've heard from people with disabilities that they haven't found their union as helpful as they would like, because they hear, oh, my union is there for pay, and I look like I'm wanting special treatment, and they don't want to participate in that. But lately, unions are hearing more and more about this. And so they are recognizing, and they even legally have had some challenges where they have not done as good a job accommodating people with disabilities, and are now helping and learning more. And Amanda, I don't know, you would have, I guess, been part of a union. I don't know if you had experiences with your union.
Yeah, I did. Being a registered nurse, I was part of a union, and I didn't find them super supportive in the time, but at the same time, I also didn't really know the right questions to ask. And it was very quick to just be off work to get the pay that you need that way, instead of trying to figure out how to make it work with you. So I do wish that I had spent more time investigating into that and talking to my union representative to see how they truly could have worked for me. I took a lot of answers at face value without truly asking a lot of questions because I was overwhelmed. So I think it's important just to take those moments before crisis to make these plans, to ask your union these questions, so that you're not just relying on answers and not having the brain capacity to question back and truly advocate for yourself. So again, act before crisis is kind of my biggest, pedestal I stand on, I guess.
That's a good message, I think, in anything to do with MS, if you can, absolutely. Okay, our last question comes from, this might be too much of a personal issue, but this person is asking about night shift. They have a hard time managing night shifts. Do you have any suggestions? Sounds like that's exactly what the tool is for.
Mm-hmm. Amanda, do you take that one first, and then I'll...
Sure. I guess my recommendation, I totally hear you, that night shifts are crazy hard with our circadian rhythms, and especially living with MS, we find that affects us even more. If night shifts are your only options, then I guess just go through the tool and figure out what specific needs can accommodate you would be my first step of advice. And then my next one would to see if going to a day pattern instead would work better for you. But yeah, without knowing too much information, hard to answer too specifically. So sorry for the vague answer, but I guess take the tool to see how that can accommodate for you. And yeah, if you can get onto day shifts, I will admit it did make a big difference for me in the longevity of those first years of sticking in nursing, not having to do the flipping back and forth. But I realize that's not everybody's abilities are within your job. So to ask Monique, go ahead if you have more.
Yeah, I'll just say some words of caution, things to think about. So not specifically, but night shifts, you should know, are one of the most contested areas of work that people hate. Everybody hates night shifts, even when they're well. So there's a lot of attention on night shifts, and employers are a bit reactive when they're asked about changing them sometimes. And this is sometimes where they push back with this is undue hardship. If this is considered essential to your job, you may, if you push too hard, find someone saying, well, then we're going to have to let you go because we consider it essential. But as you're saying, Amanda, with biorhythms and health, if you get a physician note that can talk about what it is, how it impacts health, it's not just that you don't like it, but it actually could have some harm. You might have a situation where it can be negotiated and you can change your shifts to some extent. But again, your colleagues tend to push back. They don't like them either. And so there can be a lot of things to think about. But number one, of course, to think about is your health. If you can't do night shifts, you need to understand that and be clear about why that is, because that does come first.
Well, excellent advice from both of you. Thank you so much for your work on this, and thank you for sharing it with us. That is the end of our time for questions. I want to thank Monique and Amanda again for being here today. I think you've laid this out beautifully for us, and I think it'll be a really valuable tool for the MS community. So thanks so much for being here today.
Thank you.
Thank you so much, Gabby.
All right, as we wrap up today's broadcast, we want to remind everybody about how you can connect with the MS Knowledge Network. This is staffed by trained navigators, we call them, and they're the people who can provide consistent, quality information and support. You can contact them by phone, email, or live chat through the MS Canada website. Now, we want you to be a part of the MS community and encourage you to get involved with our programs, services, events, government relations, and volunteer opportunities, like Amanda was referring to in today's presentation. These days, connecting with each other is more important than ever, and more information is available on our website at www.mscanada.ca. Now, if you have any questions about our education activities, you can reach out to the education team always by email. That's education@mscanada.ca or information@spcanada.ca. So again, that's education@mscanada.ca. For more information about any of the educational presentations that we've done, including today's, the question earlier today was about today's slides. That's the way to get them. So there's the email up on the screen, education@mscanada.ca. That's who you email to, and the slides will be sent to you. I hope you enjoyed today's presentation as much as I did. I thought it really had some valuable insights for all of us in the MS community. On behalf of MS Canada, thank you for tuning in to today's webinar. Take good care. Bye-bye.